We continue our team coverage tonight of the variant here in the Bay Area and the questions coming in since the person infected was fully vaccinated but did not have a booster shot. KRON 4's Rob Nesbitt has that part of our coverage.
Health experts credit the person's mild symptoms to their full vaccination status, hoping others will feel motivated to get their first shots or their boosters if they haven't already done so. The news of the first known Omicron case in the U.S. came from the top. Dr. Anthony Fauci telling reporters Wednesday that it proves what he and others have been saying for nearly a year.
I think what's happening now is another example of why it's important for people to get vaccinated who've not been vaccinated, but also boosting.
Infectious disease expert Dr. John Swartzberg says the speed of the Omicron variant was no surprise to him.
I would have been shocked if we hadn't identified it either today or tomorrow.
Echoing the CDC's thoughts on boosters, saying follow-up shots are just as important as your first to protect against the seriousness of the new variant.
With J&J, it waned after 2 months. With Moderna and Pfizer, the two mRNA vaccines, it wanes after about 6 months from your last injection.
Vaccines are effective, but not 100%, according to Dr. Swartzberg. He says a glimpse into a hospital's ICU is proof of that.
For every one person who's in that ICU who is vaccinated and has had a breakthrough infection, you're going to see 5, 10, 15, or 20 people who aren't vaccinated.
Vaccine supply is not an issue in the U.S. compared to places like South Africa, where Omicron was first discovered. Dr. Swartzberg, who teaches a class on vaccine hesitancy at UC Berkeley, says misinformation is an issue.
To see people not avail themselves of a tool that's going to protect them and protect their loved ones just is heartbreaking.
According to the CDC, nearly 60% of the country has been fully vaccinated. In San Francisco, I'm Rob Nesbitt, KRON 4 News.